Hello and welcome. You're watching Business Today TV. I'm Sakshi Batra. Well, on this special edition, we're going to be focusing on the company that has made the D Street debut. Mankind Pharma has made a rocking debut on day one on D Street with a listing of over 20% premium. We've seen the listing at 1300 versus 1080 rupees of an issue price. Remember, the IPO was subscribed over 15 times, and now it has also made this stellar debut on D Street. Now, also going forward from here, what is it that we can expect from the company as far as the growth projections are concerned, the business outlook going forward? To discuss all of these insights with me, joining in our top management firms, companies, management as well. With me is Mr. Ramesh Juneja, Chairman of Mankind Pharma. Also joining in is Mr. Rajeev Juneja, Vice Chairman and MD of Mankind Pharma. Welcome, gentlemen, and many congratulations to you for the stellar show today. We've been discussing all about, the company, the kind of journey that you've fulfilled so far. Now the day has started. It's a historic day, clearly. Over the last how many years that you've started this journey, this definitely means something for you, something that you had really aspired for. Rajiv, we've been discussing with you all about the company's future plans as well. So let me first today kickstart this discussion with Ramesh Juneja. Ramesh, what does today's debut mean to you? What was the feeling like when you rang the bell at NSE, and what do we expect from you going forward now?
It's a great day for us, and I'm more happy that the results are showing very good. And I mean, our investors started earning. This is what
Absolutely.
Right.
Right.
When the investors, particularly retail investors, are happy. Naturally, it gives pleasure to us, gives inspiration to us. We are motivated to go further. This is what
Sure, absolutely. I mean, it's been a solid start, Rajiv. About 20% upside on listing time, and then therefore we continue to see the share prices surge. Macquarie had given a 1400 target price right before the listing, and that seems to have been achieved right on day one as well. Your own thoughts as to what can we expect going forward?
See, the point basically is what my belief basically is what in Mankind, the belief is outcome. Investors' belief is just the outcome. It's where we are supposed to focus is on business, how good we are doing, what new things are we doing. We should not be distracted by these things. And Mankind has always believed in long-term intangible things.
Sure.
Very happy on one side. There's no doubt about this. But at the same time, there is a tremendous responsibility on our shoulders.
Yes.
And we are supposed to really, come up to the expectations, rather surprise people. This is what I can say, and I'll be very happy. You've seen kind of a enthusiasm. It means people really have so much of trust and faith in 5 years, 10 years, and decades to come. There, my mind is going right.
Right. Ramesh, we were discussing earlier with Rajiv also when we had this interaction before, but from you also, I wanted to understand that you mentioned in your RHP about your growth versus the Indian pharma industry is 1.3 times. In the chronic side, it's even better at 1.4 times. I wanted to understand, is this really sustainable now that you have a bigger base? What is your growth outlook there?
No, I think we are continuously growing with almost, more than industry growth average. And having more products in our portfolio for chronic products, having more divisions, new divisions. We will go for new, anti-cancer drugs and various other drugs coming in our portfolio. Hello?
Right. No, we can hear you, Ramesh, on that. And, Rajiv, for you also, like I mentioned that, Macquarie had mentioned right before its listing that, they have initiated coverage with a 1400 target price. Mankind Pharma, they say, appears to be well positioned to double its profit after tax by FY26. Is that possible as a target for you?
I will not speculate on that. Look at the journey of Mankind. 50 lakh rupees invested 27 years back, and whatever the valuation you see is right now. On the basis of that, you make your own assumptions. our focus would always be there on the business side, and if business is growing, share price will increase. If profits are growing, share price will increase, and that would benefit all the investors. So mine is actually on long-term strategies rather than looking at the share price on daily basis. We'll have a look at that. Uh, for your information, the first thing I did was that to get away from all these distractions, keep
Yeah.
our focus on just working, delete money control from a phone.
Right. Right.
So we
Right.
have complete focus. See, this is an outcome of our last 27 years of working.
Right.
We know it very well. We will keep doing good job. We'll keep differentiating, keep adding those things in mankind which enhances the value of mankind. Uh, People will see that. That's what we
Sure.
believe.
Sure. I'll circle back to that as well in terms of what all offerings then we can expect going forward from Mankind from you. But Ramesh, when we look at Mankind Pharma, we've seen that the gross margin is better than some of your peers as well. What is really giving you the edge over your peers?
No, we are giving quality products at an affordable price. It's always our, when we do it, we need to know when we do it, and actually, when there's a lot of saving for the patients, and actually the faith of the doctor and the patients, faith in the company increases. That's one of the reasons that our growth would be continuously there.
And
Right.
to explain this, it's always basically, I mean, how you basically efficiently work. I mean, make sure that your operations are efficient at the same time. To expand on that, when we have 75% of our manufacturing in house, that also
Yeah.
gives us a lot of power of bringing more efficiency.
Right. But Rajeev, since you mentioned that, so much of your production happens in-house itself, the capacity utilization, there have been some concerns that still remains low and there is a lot of scope for improvement right there. Would you be focusing on that part?
See, I mean, right now, if you look at this production side, 65% of the production have the capacity utilization is 65%, right? In some of the plants, it is 90%. So going forward, I mean, a little amount of 5% of our money will go in capex. Rest, we are very sure that whatever money we have invested in the last couple of years is quite sufficient. Going forward, that would suffice. And whatever extra money will generate will look for a strategical kind of a M&A. If right company comes forward, I mean, we see some right company having domestic sales, company having electronic side, consumer side, but some consumer products or some standalone electronic products, we try to
Right.
acquire those.
Right. Rajeev, now you talk about M&A and that's exactly where I was coming to. You recently acquired Panacea Biotech. Now, many analysts over here believe that, it has been an expensive acquisition. What is your own sense of how soon will this begin contributing to your overall growth in both revenues and margins?
See, whenever you look at M&A, don't look only the data which basically comes in terms of figures. The point is what any M&A is good or bad on the basis of what it brings to the present organization. It brings value addition. I explained in the past as well that transplant business, patented product, anti products, everything fall in right place. Demolate, which basically shifting in our consuming side at the efficient, would be a fantastic fit. And answering to your question that how soon this will do very good.
Yeah.
But going forward, you'll see wonderful response in future. It takes at least a few months, few quarters to really, I mean, align the new organization into new organization. Plus, you say expensive? No, it's not expensive. I mean, when we bought this company, it was 20 times the EBITDA. The gross margins of Panacea were always more than man. They always brought, I mean, amazing product. Chronic, patented, one product to the consumer side, and niche therapy like transplant. We're extremely happy that we could acquire this company. And going forward, we see a lot of good things will happen from NHS.
Right. Ramesh, could you list out for us the 2 or 3 strategic focus areas for you over the next 2-3 years? What can we expect from the company? We do see that chronic and consumer healthcare both are the segments that you're focused in right now. How will this really pan out? The kind of products that we can expect from your portfolio?
Like very recently, last couple of years ago, we launched one hormone products, and we had a just on. We were the second in the world to produce the API of that particular product, and likewise, number of other products are in the pipeline. And the moment we get the permission from the authorities, and obviously we will go for that.
Just one last question to you, Ramesh. Is there any thought of later on any stage transferring the top management control to professionals rather than having it with the family members?
Right, this process is going on. This process is going on.
How
And
soon do we see that? I mean, if you're saying that the process is going on?
Hiring more professionals, experienced people, experts, and naturally, at one particular time, we will utilize the organization. That will work.
Okay.
And then the question you asked about the dependency on family, I think will be reduced.
Okay. Well, thank you so much, Ramesh and Rajeev, both of you, for being with us on this edition. Many, many congratulations yet again on a solid start on this D Street space. And we shall continue to touch base with you to understand more about the insights about your business outlook going forward as well. Many thanks for being with us. And again, congratulations on this stellar debut. And with that, we will wrap up this edition. Mankind Pharma, definitely a solid start to D Street, 20% premium listing, and it continues to surge. 14 as the high of the day that was clocked in. Slight profit booking after that, but the company's focus is likely to be on both these chronic segments and consumer healthcare. They are open to M&A as well going forward, and very, very importantly, the management did talk about how slowly and gradually they are looking at hiring more professionals, and sooner or later we will be able to see that the top management control that currently rests with the family members may be passed on as well to, and the control of the management on the top positions may reduce going forward from here. So that's an important clarification coming in from the management on day one as well. And with that, we wrap up, but do stay tuned on to Business Today TV to catch all the updates from the world of business and stock markets.
If you like the video, do like, comment, share and subscribe.